Hello, fellow mamas. Congratulations on being pregnant. It is an incredible journey, but it can come with a lot of aches and pains, and stretching throughout your pregnancy, as long as it's fine with your doctor, is a really smart move. I get a lot of restless leg syndrome, and the first one that we're gonna do is gonna target that. I find that my body gets tighter at night, and this is one that I like to do at night, but you can do this anytime during the day. You can stop and drop and do it. I do it. My husband thinks I'm crazy, but I'm the one carrying the baby, so I get to do whatever I want. So we're gonna start in a downward facing dog, but it's a little bit different. So you wanna have your feet pretty wide. You can even go as wide as the mat. And then you're gonna turn your toes in and your heels out. And then as you do this, don't stress about the shape so much. Just pedal into one foot and then the other, pressing into the hands. You can always put blocks underneath the hands if you'd like. You can always keep the knees a little bit bent, but just sort of stretching out any of the aches and pains. And like I said before, this is a really great one to do in the evening when your legs start to act up, or if you feel like the baby is pressing on a nerve. And then from here, you're going to extend the right leg up and back, open the hip up, giving yourself a really nice side stretch, pressing into the hands. And then from here, extend the foot in front of you, step it to the outside of the right hand. If that is too difficult for you to get there, you can always take the hand to the foot and bring it forward. And then you're gonna come here into lizard pose. You can drop the hips a little bit. If this is too intense, drop the back knee down, but you wanna feel a nice stretch in the front of the left hip. If you are very flexible, you can always come down onto your forearms. You wanna breathe into the pose, relax into it. If the back leg is straight, really straighten it. Think about tightening into your quads. From here, take the hands down to the floor, step the left foot forward, and then we're gonna come down into squat, which is probably one of the most traditional poses for being pregnant. Some people do this in labor. You wanna have your elbows to the inside of the knees, press the hands together, roll the shoulders back, and try to get your spine as straight as possible. If this is too difficult, you can sit up on some pillows or a block. You can also place a towel underneath your heels. Try to breathe into the pose for at least 5 breaths. From here, take the hands down, step back into that nice wide downward facing dog. The benefits of doing poses multiple times, the repetition, is that you go deeper into them. So maybe this second time around, you don't pedal the feet out and you just try to press the hands into the floor to press the heels towards the mat. Take a deep breath in and exhale out. Again, deep breath in, exhale out. Breathe in and breathe out. Step your right foot in a little bit, take your left leg up, open the hip up. You might hear a little bit of clicking. As you do this, feel how more weight goes down through the right heel. Extend the leg long, step the left foot to the outside of the left hand. And again, decide for yourself, am I gonna stay up here? Am I gonna drop the knee down? But be present for the opening of the hips. If you wanna keep the leg up and lower down into the forearms, roll the shoulders back, don't put any tension into your shoulders. Then deep breath in and exhale out. Good, inhale in, keep your foot flexed. Exhale out, inhale in, and exhale out. Press the floor away, step the right foot forward, so second squat. Maybe you can go a little bit deeper, slowly lower into it. All of these poses should be done very slowly. Take the hands together, sit up nice and tall. Try to focus your eyes so you don't get dizzy. Deep breath in. And then exhale further into the pose. Deep breath in. Exhale out. And inhale in. And exhale out. From here, take the hands behind yourself. Remove anything that you might be sitting on. Sit back. And one of my favorite poses is also great if you get restless leg syndrome, but also just opening up. So much is going on in this area of our bodies. You're gonna cross your right ankle over your left knee. If this is very intense for you, extend the bottom leg straight, and you can slowly press the right knee down. If you would like to go a little further, bend the bottom leg in, take the hands behind yourself. And then if you're super duper flexible, you can bend the bottom knee in. Your right knee should be on top of the left ankle, and then the right ankle should be on top of the left knee. And you can either stay here, or you can begin to fold forward, but just opening all the way up into the hips, relaxing the muscles that are getting tight. Deep breath in And exhale out. Try to let it be easy in the shoulders, easy in the face. Last time, breathe in and breathe out. I'm gonna sit up, and it's as simple as just changing the other side. My left hip is a little bit tighter than my right hip, so sometimes I feel like I have to not go as deeply into the pose. So you choose which version is going to work for you. Again, if you take the hands behind yourself, don't collapse into it, but press through the shoulders, pressing the chest forward. And then again, if you just do decide to go for that deeper stretch, ankle on top of the knee, knee on top of the ankle, so you're making a little square shape. And then again, deciding how far you go. As your belly gets bigger, obviously you will not be able to lower as much, but really trying to soften into the hips. If it feels too intense and you feel that the body is seizing up a little bit, just pull back a little. If you're tightening into the pose, you won't get more flexible and you won't get the benefits. 2 more breaths. Inhale in. Exhale out. Relax your face. Last time, breathe in and breathe out.